Okay. Namaste all. Welcome to yet another beautiful Mano Yoga pre-conference session. We will start with our Siddhata Dhyana. All of you, please close your eyes. Take a deep breath. Observe your body from top to toe. And silently chant Omkara for 5 times. Connect to the universal energy. Asato mam satgamayam tamaso ma jyotirgamayam mrutyorma amrutangamayam. Om Shanti Shanti Shanti. Please connect to the masters and let's do Guru Stuti. Om Ajnanatimirandasya Gnananjanashalakaya Chakshuranam Udmilitam Yena Tasmai Shri Gurave Namaha. Rub your palms. Gently rub your palms. Feel the warmth. Bring it close to your eyes. Gently massage your eyes, your head. Let it flow through your whole body. Open your eyes with a big, beautiful smile. Thank you all. Objective of today. So today is a pre-conference for the Mana Yoga. It's a curtain raiser for the larger event, which is happening as part of the Global Yoga Summit on December 23rd and 24th in Bangalore. And so this is a run-up, and it gives a glimpse of various speakers, who would be participating in the prime time for December Global Yoga Summit. And what do we have today? Today's topic is mind-body connection, origin of psychosomatic disorder. As per the Taittiriya Upanishad, we are made up of Panchakoshas, which are 5 sheets, namely the Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, Vijnanamaya Kosha, and Anandamaya Kosha. The Annamaya Kosha is the gross body or the physical body. It is actually connected to the Manomaya Kosha, which is the mental body. And it is scientifically proven that when our mind is affected due to stressful situations, the stress hormones are released into the body, which on long term damages many of our organ systems and leads to what is called as psychosomatic disorders. So this term is used to refer to a condition which a physical disease is caused or made worse by the mental stress. Some of the examples of psychosomatic disorders include peptic ulcers, bronchial asthma, rheumatic arthritis, insomnia, diabetes, hypertension, and many more. Now, the yogic techniques, the Mana Yoga techniques such as Yoga Nidra, meditation, deep breathing, pranayama can relax the mind and help in the treatment of the above. And we will get to know more about this when our speaker talks about it. So stay tuned. I would like to now welcome our speaker, Dr. Shobha Rani R H. Dr. Shobha Rani is the director of the Pharmacy College in Bangalore, namely Aditya BIPER. She has held important positions in the past, such as the Dean in Rajiv Gandhi University of Health Sciences, Karnataka, Academic Council member, Board of Studies, Chairperson, and Principal. She has over 30 plus years of professional experience. She has published more than 100 research papers in pharmacy and health sciences. She has presented more than 150 papers, lectures at the national and the international journals. She has widely traveled across more than 20 countries. Dr. Shobha Rani has won many awards for her contribution in the field of pharmacy. She is as much interested in spirituality as in the modern science. Dr. Shobha Rani is a student of Sri Ramachandra Guruji as well as Sri Dr. Vishwanath Guruji. Dr. Shobha is part of our Spiritual Solution Center, and both Dr. Vishwanath Guruji and Guruma Dr. Gayatri are our mentors in Mana Yoga. So without much ado, let me quickly transition on to Dr. Shobha Rani ji. Over to you, please.
Namaste to everyone. At the outset, I would like to express my gratitude to Guruji Yogi Devraj, my Guruji Dr. Vishwanath Guruji, my Guruma Dr. Gayatri Vishwanath, then the entire team of SSC, and all of you who have taken out time to log in. Namaste to all of you. Shri Guru Bhyo Namaha. And I thank the Gurus for giving me this opportunity to present some of my thoughts in today's webinar. My topic actually already Praveen ji has, thank you Praveen ji for the introduction. And Praveen ji already gave the abstract of my talk, so it's made my job much easier. So I'll just give me a second. I'll try to share my presentation. Is it visible? I just want to check.
Yes.
Okay. So I have about 35 to 40 minutes, so I'll be brief while explaining. If any doubts, you can just put it in the chat box. I'll try to clarify at the end of the session. So my topic for the day is mind-body connection and origin of psychosomatic disorders. Praveen ji already mentioned about this 5 koshas. So as per the Taittiriya Upanishad, we are not just the gross body, what we are seeing. So we are made up of 5 koshas known as Annamaya kosha, which is the gross body, Pranamaya kosha, which is the energy body. So in the Pranamaya kosha, we have the nadis and the chakras. Then we have the Manomaya kosha, which is the mind body or the emotional body, where our emotions and thoughts reside. Then we have the Vijnanamaya kosha, that is the wisdom body, where the intellect, the decision-making capacity is from this. And then we have the Anandamaya kosha or the bliss body. And I'm sure some of you, all of us at some point in our time, we would have felt this complete bliss at some point of time. And that is a point when you have touched this bliss body. So actually, according to Taittiriya Upanishad, Anando Brahma. So that cannot be witnessed. We are only the bliss. We are bliss and it has to be experienced. And we experience it at certain points, whereas the yogis experience at that samadhi state. Now I'm straight away going to my topic. So what is stress? So stress is a state of worry or mental tension. So that is which we all of us definitely experience at some point or the other when we are exposed to certain unpleasant or challenging situations in our daily life. So as simple as a traffic can put us for stress. So there are so many reasons for or situations that can cause stress. First one can be personal, like losing some loved ones, losing whoever is close to us. It could be our parents, it could be our siblings. So losing the loved ones due to death or separation with the loved ones or experiencing abuse or chronic illness like cancer, all these can cause stress. Second is the family or the relationships that is going through a breakup or getting divorced certainly causes stress, and difficult relationships with parents and children. Like parents may be facing difficult relationships with the children and vice versa. That also leads to stress. And third and most common is studies and employment. So exams and deadlines, parental pressure. So nowadays kids are exposed to so much of stress because of the expectation of their parents and the syllabus and the examination system. All this causes stress. And coming to the youth, losing the job, not getting the job, or difficult boss, difficult, unpleasant atmosphere in the office, all this can lead to stress. Next point is housing, that is not having our own house or shifting the house very often also can be a stressor. Then money, of course, is definitely a stressor because financial constraints or having debts to clear definitely causes stress. And social factor, recently we have faced the global pandemic, COVID. So we were all under stress. All of us have experienced this. And experiencing stigma. Stigma could be like, it could be racism, or it could be having, say, HIV, or it could be any kind of thing which is not neutral gender. All these can be a stigma. All of these are the stressors. And what negative emotions are experienced during stress? We experience, like most of you would have experienced at least some of these: anxiety, fear, sorrow, grief, worry, frustration, guilt, depression, resentment, tensions, regret, hate, anger, shame, hopelessness. So these are all the emotions. And what reaction happens? I'm sure most of you feel that now that sweating starts. And somewhere in this region, neck will start paining, or you have some butterflies in the stomach, like, or you start feeling nauseated. Most of us, and in fact, we all used to vomit on the day of the toughest paper of our exam. So that is also a stress symptom. So diarrhea also is experienced, restlessness, irritability, and suppose you have continuous work in an office where the environment is not conducive, you come back with a headache and feeling of lump in the throat, sore or aching muscles throughout the back, and of course, unable to sleep. These are some of the reactions to stress. Now here I want to just show you the same thing, but stress response in the body. What happens when you are exposed to stress? Now mood changes, including increased irritability and anxiety. The heart rate and the blood pressure increases. The diaphragm is pushed upwards and it causes shallow, quick breathing. You might have observed when you are stressed, you breathe fast. Fast breathing will be there. When inflammation levels rise throughout the body, so aches and pains. When muscle tension and the muscles tense and they tighten to respond to the stimulus. When even digestion issues like cramps, poor nutrient absorption, abnormal bowel movements, which can lead to either constipation or diarrhea. So all these are the common response to stress by our body. Now, what happens inside our body during stress? Actually, the minute the body is exposed to stress, the adrenal glands, these are the endocrine glands, they are located on top of the kidneys. So you can see they are on top of the kidneys. In the first reaction is they release the stress hormones. There are three main stress hormones: adrenaline, norepinephrine, and cortisol. Now, these actually the body prepares ourselves. You might have heard in your school days the fight or the flight response. This is caused either we have to fight with the situation or flight, go away from the situation. Like suppose a snake comes in front of you. What should you do? You should have the ability to run away or you should be able to face it. So these hormones help us to deal with stressful situations by increasing our heart rate, blood pressure, blood sugar levels, and all these reactions, it can help us to fight or flight. Now, what is adrenaline? What does it do? It's a stress hormone. It readies the body for action. It accelerates the heart rate, our energy levels, and focus, priming for the flight or the fight response in challenging situations. So it's an important stress hormone. And actually, the stress hormones are required. That is, in acute conditions, we have to have these hormones actually. Only in chronic, if it becomes too much, it is damaging. Then what is this norepinephrine? Let's see. It makes the breathing shallow and it makes the breathing rate increase. And the blood flow to the skeletal muscles increases. Heart rate increases. When pupils dilate, the intestinal muscles relax, then the blood pressure increases, the blood sugar increases. So these are the effects of norepinephrine. And what is the effect of cortisol, which is one of the major stress hormones? So it also increases the blood sugar, heightened memory and attention, because you need attention to take whatever decisions during the stress situation. So heightened memory and attention. It suppresses the immune system. It decreases serotonin, which is a happy hormone. It decreases sensitivity to pain, and it increases the blood pressure. So these are some of the way in which it acts. So in anxiety, cortisol and norepinephrine are normally released. During fear and tension, adrenaline and cortisol are released. During depression, cortisol is released. So in almost all conditions, cortisol is definitely released. Now, what are psychosomatic disorders? It refers to a condition in which a physical disease is caused or it is made worse by the mental stress. So examples include insomnia, diabetes, hypertension. I'll show you more of them. So you can see the effect of stress. So you can, why cold and flu? Because it brings down the immunity. Then asthma, heart disease, stomach ulcers, post-traumatic stress disorder, eczema and other skin disorders, depression, cancer. That is, if the person is already having cancer, the growth of the cancer cells is increased with stress. So suppose there is a repressed anger which is not expressed and which is repressed. It is normally reported to cause tension headache, migraines, chronic back pain, fibromyalgia, and so on. Anger causes shouting, that anger mood if the people have, and the long run it causes high blood pressure and heart disease. Anxiety causes irritable bowel syndrome, mitral valve prolapse, and heart palpitation. Resentment, which is most common, it causes autoimmune disorders, rheumatoid arthritis, lupus, and multiple sclerosis. And Mana Yoga, certainly, it can remove all these from the root. See, treat them from the root without the medication. And certainly, I can vouch for it. Mano Yoga helps. The whatever Guruji is teaching, Guru Ma is teaching at the Spiritual Solution Center. It could be past life regression, it could be Yoga Nidra, it could be hypnotic healing. All these techniques, they help to remove the repressed anger or resentment and anxiety and so on, and helps in the management of the psychosomatic disorders. Now, just briefly, the effect of stress on different organs. Let's take up GIT first, that is gastrointestinal tract. There is a network of neurons in the lining of the GIT known as the enteric or the intrinsic nervous system. So during stress, what happens is the esophagus goes into spasms and there is increased acid secretion in the stomach. There is indigestion happening, nausea, diarrhea, or constipation. As I told you, stress is good if it is in acute situations. If it's a few minutes, it is good because it helps you. But if it is chronic, suppose continuously the person is facing stress, then what happens? Cortisol, all these hormones are continuously released. Then continuously, if the acid is increased in the stomach, what happens? It leads to peptic ulcers. Continuously, if there is indigestion, what happens? It leads to another colonic problems. So anything which is continuously dragged, it leads to a bigger disease, and then it becomes difficult to treat. Let's see cardiovascular system. In the short term acute stress, heart beats harder and faster, and blood vessels dilate, pushing more blood into the large muscles and raising the blood pressure. But long term, the same thing what happens? Consistently, if the heart rate is elevated, consistently if the blood pressure is high, certainly you develop hypertension, and there is 100% chances of getting heart attack and stroke. Then respiratory system. All of us, I told you previously, we have all experienced under stress conditions, we start breathing faster. There is shortness of breath. There is rapid breathing. Why? Because the airways between the nose and the lungs, it constricts. Between the nose and the lungs, it constricts. And because of the constriction of the airways, it leads to difficulties in breathing and it leads to wheezing. This can also cause, because of this constriction, it can also cause dizziness, lightheadedness, and a feeling of not getting enough air. You feel suffocated. And already if the persons are having asthma or COPD, it flares up. The condition flares up. And coming to the nervous system, cortisol damages the brain as well as it affects learning and memory. So cognitive, like memory and learning, are impaired. And stress can cause an imbalance of neural circuitry, which are responsible for cognition, decision making, and anxiety and mood, that can increase or decrease the expression. That means either he can become overly anxious or he can become depressed. He can become hyper or he can totally become withdrawn. So on the whole, certainly it is not good for the nervous system. Now coming to the musculoskeletal system, it causes the muscles to contract. It restricts the blood flow. So when the same thing is continued with chronic stress, the musculoskeletal system is in a permanent state of constriction. So what does it happen? I mean, what does happen under these conditions is chronic pain, including back pain and neck pain, and it also can lead to disorders like secondary disorders like migraines. Stress and cholesterol. When cortisol and adrenaline are released, it raises the cholesterol levels. Now, as cortisol is released, the body's blood glucose level rises. And now when the body's blood glucose level is increased, it creates more triglycerides. How and why? Maybe in detail I can explain in the next few sessions. But today we do not have the time. But you just understand that it creates more triglyceride production. So higher the triglyceride production, higher the cholesterol levels. So they're directly proportional. Then stress in diabetes, stress, as you all know now, it increases your cortisol levels. Now, under stress, cortisol delivers glucose to the body. We need some more glucose is released. Why? Because glucose gives you the energy to which helps you to fight or flight mechanism to function properly. But under chronic stress, continuously glucose is being released. So when glucose is constantly high, obviously it leads to diabetes. So there's a direct relationship between stress and diabetes. Now coming to stress and immunity, there are several publications. One of them I've just quoted, Psychological Stress and Human Immune System. A meta-analysis has been done for 30 years of inquiry. So this is the paper for anyone who's interested. So the results of this study says that when the stress conditions are there, the components of our immune system are affected in a detrimental way. That means our immunity goes down. So when the immunity goes down, we are prone to many diseases. Stress and cancer, the relationship between chronic stress and cancer is not clear as there is no proper evidence. However, suppose a person already has cancer cells in his body, stress can speed up the spread of cancer cells throughout the body, especially in ovarian cancer, breast cancer, and colorectal cancer. So it stimulates the cancer cells. Stress stimulates the cancer cells. So in patients who already have or who have had cancer, studies have found that stress is linked to the tumor growth. The last I've taken is stress and insomnia. All of us know that if you are stressed, we are not able to sleep. So researchers have found that higher cortisol levels are linked to sleep deprivation or a serious lack of sleep, as well as which leads to insomnia. So we understood that under stress conditions, what happens? Stress hormones are released. You understood there are 3 major stress hormones, and they are responsible for many of the bodily functions to get altered, leading to psychosomatic disorders. Now, what can be done now? We cannot avoid stress altogether. For example, we all have to go for work. We will not have all conducive atmosphere how we want. We will not be able to get in the workplace, or the traffic will be as bad as what we are having. So we cannot alter the stressors. Actually, it's not in our hands. So what is in our hands is to practice certain techniques so that we can manage the stress. And the yoga techniques are, there are certain asanas like this, what do you call this? Marja, this is cat pose. Cat pose. And then this Viparita Karani, this also, and extended triangle pose, then Balakasana, all these, Shavasana, of course, all of us know, and even standing forward bend, all these techniques are supposed to alleviate stress. And there is no second opinion on how useful the pranayama techniques are in relieving the stress. Even as simple as deep breathing or abdominal breathing is found to relieve the stress. And the very useful pranayama techniques are Nadi Shodhana pranayama, Brahmari pranayama, Kapalabhati, Ujjayi pranayama, and then Shitali and Shitkari pranayama, Bhastrika pranayama. So you're all yoga enthusiastic, so I'm sure you're familiar with these techniques. So these cause relaxation. Whatever the stress hormones are causing, these will reverse that. So the breathing gets slow. The stressors will cause faster and shallow breathing. Whereas if you practice pranayama, you start doing relaxed breathing, slow breathing. So it is, the effects are just the opposite of what a stressor can cause. Another relaxation technique, Yoga Nidra. Researchers in 2020 have found that people who did 11-minute Yoga Nidra for 30 days, reduce their stress levels, enhance their overall well-being, and improve their sleep quality. Certainly, Yoga Nidra, there are several publications on the utility of Yoga Nidra in the management of stress. And meditation, of course, is a practice that incorporates different techniques. Like some of them have breathing as while observing the breath, do the meditation. Some of them use chantings to do the meditation. So there are different techniques that people use that can result in changes in the consciousness, and it has been shown to have number of health benefits. As I told in the relaxation technique, it affects the body in an exactly the opposite way by triggering the body's relaxation response. So the thoughts quieten, better oxygen consumption, heart rate slows down, deep breathing. So all these restores the body to a calm state, helps the body to repair itself, and prevents new damage from the physical effects of the stress. And other techniques, especially for resentment, I think this forgiveness really helps. Forgiveness heals. Gratitude journal. So every day, expressing your gratitude, keeping a gratitude journal, and then count your blessings, thanking the people, count your blessings. Then daily affirmations for healing, satsang, and reading good spiritual books, and having a good nutritional diet, and then doing small exercise like walking and yoga definitely helps. So in conclusion, I would say the fundamental principle of yoga is that your body and mind are connected. So you saw in the Panchakoshas also that the Annamaya Kosha and the Manomaya Kosha are together. In between them is the Pranamaya Kosha. They're bound with the help of the Pranamaya Kosha. So they're connected. So practicing yoga will help to balance, help to harmonize the connection between the body and the mind, and it helps you to remain calm and relaxed, which in turn leads to a healthy body. And research has shown that those who relax the body and the mind, and for those who practice yoga or the Mano Yoga and practice meditation regularly, what happens is they begin to experience changes in the response to stress. We have heard of the term resilience, which is very, very important. That is, even if you come across stressful situation, you'll be able to recover. Your response to stress will not be that strong. You'll be able to take it and then recover from the stressful situations more easily. So, in conclusion, I would say that all of us should practice yoga, and especially the Mano Yoga techniques. Please contact Spiritual Solutions Center. Our Guruji is there, our Guruma is there. They will help you in learning these techniques, and which will help you to keep your mind calm. Healthy body plus healthy mind gives you happy life. So with that, I wish to thank all of you for a very patient hearing. Thank you, Guruji, and thank you, Guruma, once again. And thanks to the entire team of SSC for the arrangements. Thank you, Pravinji, also for the arrangements. And all. Thank you. Thanks,
Dr. Shobha Rani ji.
Managed in the time.
No. You not just managed. You are well ahead. So you have more time. If you want to take additional, 5-10 minutes, please do so. I'm also looking at the chat. Maybe I think the audience is still captivated. They have not really asked any questions. Of course, I have my own questions, which I can definitely bring up while we await. But please take another few more minutes if you want to add anything else, and then we'll begin the Prashnotara.
Any audience want to know any aspect more? So I'll just summarize once again. I don't know whether the audience have understood or not. So I'll just summarize once again that when we are exposed when we are exposed to certain stressful conditions, our body produces stress hormones. The gland responsible for producing the stress hormone are adrenal glands, and these glands are above the kidneys. And there are three major stress hormones: adrenaline, norepinephrine, and cortisol. And a small amount, when the stress is there, these stress hormones release is actually good for us, because it increases our blood pressure, it increases our glucose level, and it prepares us for the fight or the flight response. This is the nature's way, like nature's way of protecting us. So in a acute way, having this stress hormones is good. But when the same stress hormones are released continuously, that is, if you are exposed to stressful situation day in and day out, and you are not able to manage that continuously, if these are released, it affects the various systems of our biological systems of our body. It damages, it affects adversely our cardiovascular system, it affects the musculoskeletal system, it affects the nervous system, it affects the immunity, it affects our sleep pattern, it affects our respiratory system. Almost all systems are affected. When almost all the systems are affected, what happens? It leads to what are known as psychosomatic disorders. Most of the people are suffering with hypertension and diabetes, and these are the typical psychosomatic disorders. Even insomnia is cropping up now, and there are many more. And diseases like cancer also, the cancer cells can grow more if the person is exposed to stress conditions. So what we have to do is we have to develop a mechanism by which we should be able to combat these stressful situations. So yogic practices. Yoga doesn't only include asanas. As we know, Patanjali Yoga Sutra has Ashtanga, like 8 limbs are there. There are so many techniques like asanas, pranayama, and etc. So by these techniques, we can relax our mind. We can bring in certain reactions in the body which are opposite to the reactions which are caused when we are subjected to stress. And when we relax our body, we relax our mind. When we relax our mind, the body obviously, because they're connected, the body, like the blood pressure is under control, the blood sugar also becomes under control. So many immunity goes up, then the breathing becomes long. And all these help our body also to be healthy. So this is what I was trying to tell. Therefore, I insisted that people should practice certain things like even yoga nidra and then affirmations. I gave you like even as simple as gratitude journals, forgiveness technique, then writing the journals, all these things, counting the blessings, all these things help overall a person to manage the stress. And then that resilience, I was stressing on that. That is, even if you face a stressful situation, then you'll be able to come back very quickly to the normalcy instead of sulking, instead of just brooding over it. So I hope the audience have understood.
I am seeing a lot of questions, so.
Oh, really?
Yeah, let's go through one by one. But
yeah,
I had my biggest aha moment when you said that, we cannot zero out the stress. There is a good stress, there's a bad stress. Good stress really is needed for us to do the survival, right? The fight, flight. In fact, I can quote one personal experience. When I went to Tamil Nadu, one of the temples along with my family, my little daughter went missing.
Yeah.
And for a quick 10-15 minutes, I was really I was high on adrenaline and maybe even the cortisol, because my memory was so, I don't know, I was able to scan through like hundreds of people in terms of their faces. And now I'm able to understand why I'm able to do. So
immediately we start sweating, and then our decision-making capacity goes down.
Increases, it multiplies.
Immediately we can feel their bodily reactions if we observe carefully.
Yes, so I think a lot of good things I've learned, but it's all about, as you said, ensuring that your stress is limited to a short duration. It's just like steroids. It should be like a 100-meter sprint. You quickly get over, and be done with it rather than prolonging it. Okay,
Right.
so I'll start taking some of the questions. There are like 5 questions. Divya Ramesh is saying, can you please talk about PTSD and OCD?
OCD, there are some other mechanisms are also involved in that. So the stress increases them. Yes, stress increases anything that is already there in the body. But I think the other mechanisms we can discuss. I'll discuss at a later point with you.
Okay.
Because it requires some pharmacology and all that. So I think I'll give the explanation to her privately.
Okay. So and then Manjunath BV was, I think he's put stress symptoms. Maybe he meant to say what are the different stress symptoms? Is resentment a form of, is it a triggering point, or I mean I'm just trying to understand his question, but his question was around stress symptoms and resentment. Are they the trigger or are they your outcome?
Resentment is a trigger. Resentment is a bitterness, of having been treated unjustly. You have not been treated properly. Like that is resentment. So if you keep that resentment is supposed to cause cancer also. Like the resentment, you should always, what is the best way of overcoming resentment is forgiveness. That's what, like you forgive the person. Otherwise, somebody has ill-treated you, you just keep it in your mind and then you sulk over it. Know that over a long period of time, resentment is it's a trigger. It is supposed to cause many problems, psychosomatic problems. Yeah, I read a lot about resentment.
Maybe I think you just answered there was another question from Manjunath BV. What is forgiveness? So I think I'm able to connect the dots.
Yeah. Forgiveness is you just sit and then whoever has wronged, whomever you feel that they have wronged you, just keep, imagine them in front of you and then you tell that you forgive them. And you really forgive, not just tell. You really forgive them and then, because it could be like, karmic accounts also may be there because of which we might have done something in the past for which they may be doing something. There are so many things spiritually, if you look at it. So like we ask them forgiveness if at all we have done anything in our past life to them. So we say that I seek forgiveness from you for whatever I might have done in the past, and I forgive you for whatever I'm experiencing now, and let us close our karmic account and let us forgive.
I like this, it's not
That's
just.
What I do. That's what I do.
No.
I've learned it from one of the gurus. So.
Very well put, Dr. Shobha Rani. This is like not taking a myopic view, it's taking a longer horizon, surpassing the multiple lives.
We don't know, there are so many reasons. We don't know what for the person is behaving like that.
And which life did they do?
What we might have done, we don't know. Now it may be like something we are experiencing. There may be some hostility due to something. We don't know any, reasons we don't know. It's beyond our thing. So best is to ask forgiveness and to forgive them and close the karmic knots.
Safe bet. Forgiveness across all the lifespans. All right.
It has helped me. I personally have done it. It has helped me.
Okay. 2 more questions. Sushma said, how to get rid of the physical pain caused due to psychosomatic diseases? I am suffering from continuous facial and headache 24/7 for more than 1.5 years. Okay.
One is, of course, traditionally you have to go to the doctors and find out the diagnosis. Supposing you're having a headache, please consult a neurologist. Whether it is migraine headache or is there any tumor in the head, or we don't know what it is. There could be so many neurological reasons for a headache. Please consult a neurologist first to find out what is the diagnosis. So once you know the diagnosis, he will prescribe some medicines, right? So you take those medicines also, and then you also consult Spiritual Solutions Center, where there are certain things are there. Hypnotherapy is there, which are drugless therapies are there, which certain definitely will help. I'm telling you, because I have taken some of the therapies from there. So you can take the therapies, you can consult our Guruji and Guruma, and then they will help you. Like, depending on what is the problem that you're having, appropriately that therapy will be given to you, which is drugless therapy. And do not stop your medicine right away, whatever the doctor has prescribed. Slowly you see how, I'm sure the headache or whatever will come down with if the underlying reason is known, which will be known in the spiritual way. If you go, no, you will come to know. Or if it is depression and all that. Or if it is just a physical pain that has come due to physiological reasons, then it will go with the help of those medicines which the doctor has prescribed. So first step, let them go to the neurologist. Let them get the diagnosis. And with them, let them take the medicines properly. And then also consult the alternate like this. And then get rid of the medicines and continue with these methods. Because I am a physicist myself, so we know we monitor the adverse drug reactions regularly. That is, no drug is completely safe in all people, like, because they are out there synthetic, right? Even the natural ones also are not like safe. So every drug has some or the other adverse reactions. Why? Because they're chemicals themselves. So whenever you take some drug, in case, you could have as simple as nausea, vomiting. And for example, I was working in Victoria Hospital, so I can tell you TB drugs, they cause hepatic problem, they cause liver damage. So when I was seeing a patient like 30-year lady, she was having TB and she was on anti-TB drugs. And later on, she came and then she was complaining of the stomach ache. The doctors did not advise her to go for the liver function test, because we all know that they cause liver problems. And then finally what happened, by the time the doctors realized and she did that liver function test, the liver had undergone cirrhosis and she died not because of TB but because of liver cirrhosis. I have personally seen a couple of deaths also because of the adverse reactions of the drugs. Drugs like phenytoin, phenobarbital, carbamazepine. These are all very strong medicines. I have literally seen people I have seen somebody taking ofloxacin indiscriminately for 2 weeks, developed severe reaction, and the person died. So I'm not trying to scare anybody like of death or anything. It's not common. It's rare. Death is rare, but the reactions can be like, it can lead to diabetes. Steroids, if you take, it will increase the sugar levels in the body. So there are so many reactions to the drugs. So, but we have to take them also. But then alternately, if you practice the other spiritual methods, then maybe over a period of time, we can decrease the dose or we can manage with these other practices, is what I'm trying to advocate. Yes, we can't totally come out of the pharmacy, the drugs, because they are essential. But certainly we have to be aware of that. We have other drugless methods also which can help.
Okay. Maybe I think Guruji, should I proceed with, I think we have 3 more questions. Or okay.
So I was seeing some questions. It is interesting. I think Shobha Rani ji can answer it. So actually, there's a question: is psychosomatic disorder caused by karma from previous births or this birth? Nice question.
Guruji,
so Guruji himself have come to answer this question.
Yeah, I think I want the answer from Guruji.
He read our mind. Okay.
Yeah.
Right. So Shobha Rani ji was explaining what is psychosomatic disorders. Actually, origin of these problems is mind. So from the mind, it is initiated and then it is expressed on the body, right? So ultimately, the last resort is our body. So if you look at some of the diseases like diabetes, sometimes they say it is because of the hereditary. Why is that? Why do they call that? Right? So that means to say, if somebody is having the problem in that root or in that hereditary, so I think it can come to these people also. That means to say, the information is passing on. Information is passing on. So I am carrying that information. So when I am taking my birth in this life, definitely I am connecting to some information from my mom and dad. Yes or yes? And also, I will be inheriting some information from my grandpa, grandma, might be. That's what the, even medical science is, might be. So what is the idea here? The idea of information. See, right now, if the diabetes is there, the diabetes is considered as a disease. Okay. But what is the idea behind it? So how it happened? So due to stress, actually, Madam Ji was telling, due to stress, the imbalance will happen, and the imbalance of hormones and stress hormones. So ultimately, it affects on the body. That's what the idea was shared. And now, if at all we are carrying the information from the past, so it's like this. Okay, what's your personality right now? What do you think? What is the experience you are having right now? So everything is unique, yes or yes? So the way you speak, the way you think, the way you do things, everything is unique. It's connected to you and you. So some of the things, okay, though you are unique, but it is affected from our parents. So now let us think why it has to happen like this. Okay. So unknowingly, okay, somehow the Madam Ji connected, brought the karma into picture. Okay. See, when we are taking birth, there should be some phenomena. See, there should be some idea. Okay, simply will not take birth, right? There should be some reason for it. So we don't know the reason yet. We don't know what is the idea, why we have taken the birth. So we just started our life, and mom and dad started encouraging us, teaching us, guiding us. Teachers came into picture. Many people started mentoring us. So that's how our life started. And ultimately, we had some few goals of physical world, a materialistic world. What is that? Okay, having good education and getting into a good job and earning good money, and also running family, taking care of the family. See, these are the ideas we unknowingly adapted, right? But in this course of time, we come across many challenges. Have you not come across challenges? Yes. Why these challenges are? Why these challenges has to come? There should be some meaning for it. Okay. Somebody, for no reason, they lose the job. For what? Yes. Like this, there are so many challenges will come in our life. And as we all know, in 2020, 2021, it was a global karma. I used to call it as a global karma. COVID. Okay.
Yeah.
So many people got sufferings. Even actually, yesterday also, I was addressing one client. He said, after COVID, I really got into anxiety. Right? Very nice. Okay. That means to say, unknowingly, the whole setup made everyone, become anxiety, and it really triggered us many fears. Why such experience we have to carry? So when we start understanding these things, we have to go back and understand there is something behind us. There is something beyond us. There is an unknown world. There is something which is continuously triggering from inside, where we are acting or we are working according to that, right? So if you start understanding that, definitely psychosomatic disorders are connected to our karma only. Yes, because we are doing that karma. See, Shobha Rani was telling, forgiveness is a very good therapy. And if somebody is hurting me, why should I forgive? Very good. A good idea. Why should I forgive? Why you have to forgive? I'll keep that person inside if I don't forgive. And I'll keep grieving about that person if I don't forgive, if I don't forget. I will create a space for him in my heart. Hello. That person is, freely, rentless. Somebody sent me actually. Without paying rent, he's staying in me. Okay. So when he's staying in me, he's not simply sitting in me. As a memory, he's haunting me, he's gripping me, he's pulling me. Oh my God. What has to be done? Forgive. It's okay. Realize it. See, the stress was temporary, and Praveerji nicely picked up that information. Stress is temporary. Very temporary. Yes, I know that. We have to educate our mind. Stress is temporary. Okay. So the same way, when we come across these challenges, we need to have some ideas how to tackle with that. And the spiritual science will definitely give some idea. And there are many questions about it. There are many, arguments about it. So is there any, past life or something like that? Forget all those things. Just connect your womb life. Have you not experienced your womb life? 9 months, you are inside the mom's womb. SRS. Did you simply sit there? Did you enjoy that journey of 9 months? No, along with that, mom was thinking and somebody was talking, mom was feeling, everything was completely induced to you. Understand that. So that means you had a past life. What is that past life? The womb life. Right now it is past life. Right? Right now it is past life. Past life in the sense past life. The life which is past. Correct? So the life which is past is there with you. And what you have to do? You have to work with them. If at all you carry some fear from that place, if you carry some resentment or helplessness or some kind of rejection, don't you think all those things is contributing to psychosomatic disorders now? Yes, it is. If the fear is rising, definitely it will connect to anxiety. So in the childhood memories, especially the childhood memories, are the very important memories which is still ruling you. Don't you think that is the past? Still it is with you? Correct. So this is what we have to understand. A very nice topic actually. Okay, so let us discuss it in the later stage of Manoyoga conference, pre-conference. And right now, I have to remind you again. I remind you all again. There is a beautiful conference is coming, an extraordinary conference. So that is Global Yoga Summit. So you have to be there. You have to understand what is happening with you, because there are so many people who has experienced it, who has done a research. They are coming there. They are going to impart their knowledge. They are going to tell how exactly we can design our life, how exactly we can reshape, and what can be done. What are the simple remedies, and what are the important things you have to take care from right now. So now onwards, how you can go to the next level. So this is what is going to happen in Global Yoga Summit 2023, which is happening in December 23 and 24. So I need each one of you be there. So definitely I'll tell you, be there. Kindly take information from our center, how to register and how to be a part of that. And also, this journey will continue. Manoyoga journey will continue. My dear friends, so we'll meet you again with the new topics. So now, namaste to all. A great, happy to see you all. Now over to Praveenji.
Okay. Thank you, Guruji. We are pretty much at the top of the hour. So 2 more announcements. From Monday onwards, we have Samatvam with his Patanjali Yoga Sutra on Mind Management by Yogacharya Dr. M.K. Nagaraj Rao. Remember earlier on in this session, Dr. Shobha Rani was saying that, by doing all this Patanjali Yoga Sutras, you're actually able to get into a relaxation technique and bring down your stress hormones, right? So this is just what the doctor has ordered. So please join. And then the last announcement I have is next week we'll meet at the same time same place virtually on Zoom for another pre-conference session from yours truly. I'll be covering the ESG, Environment, Social and Governance, powered by Mano Yoga. So be there. Now, it's gratitude time. Yeah. Gratitude will also help you reduce your stress.
Yes,
What
absolutely.
Dr. Shobha Rani said. So,
Absolutely.
right. Thanks to Rotary Bangalore Global Yoga Universities of Americas, Swami Vivekananda Yoga Research and Holistic Health Trust, Spiritual Solutions Center, Bangalore, our beloved Guruji Dr. Vishwanath, Guruma Dr. Gayatri, to all the wonderful participants, who made time on a weekend for this wonderful session, the Compassionate Cosmos for giving us an opportunity to be part of the seminar. Let's start the Shanti Mantra and end. Om Sahana Vavatu Sahana Bhunaktu Sahaviryam Karavavahai Tejasvinamavitamastu Avidvishavahai. Om Shanti Shanti Shanti. Loka Samasta Sukhino Bhavantu. Thank you all. Have a blissful, stress-free evening. Thank you once again.
Pravinji, can we have can we click a snap like with all the people just for memory? Is it allowed?
Please take it.
Because many of them are off the video. Request all the people to on their video so that we can take a picture.
Yeah, come on. Yeah. Very good. Yeah. Smile. Camera is watching you. Smile, please. Very good. Oh, okay.
Thank you.
Got it.
Wonderful.
Thank you, Guruji and
Thank you all.
Guruma. Thank you. Thank you, Pravinji.